Sidjo, get in, it's 189. Okay, guys, ready? Okay. So, Sidjo, what's going on right now, man?
Not so much.
How are you feeling?
Feeling awesome, man. So next stop is Savannah.
We changed it. We were going to do hematuria and bladder cancer.
All right, let's talk about that.
You probably also see a decent number of patients who present with big bladder tumors who've had blood in their urine for years or months and have been treated with multiple courses and rounds of antibiotics, and no one actually thought to work it up for bladder cancer. So it's probably not an uncommon event for urologists, unfortunately.
Hey, how are you? How's it going?
Oh, it's really amazing, dude. It's really amazing.
So Dr. Akshay Benari is, once again, as I mentioned earlier, Director of Robotic Urology and Assistant Professor of Clinical Urology at Mount Sinai Medical Center.
Just to get an idea, it's got basically three components. There's a console on which the surgeon sits. There's a patient side cart, which is what is attached to the patient. And then there is the vision cart that helps. So the highlights of a robotic system are it gives you a 10 times magnification. It's a high definition 3D vision. The movements in the instruments are rich.
We're going to kind of talk about them here. So
this is I want to give credit to Dr. Viral Singh. He's kind of a pioneering urologist who's developed kind of a new visual Foley catheter system. So we'll talk a little bit about that. The whole
now, this is something that's used to actually look inside the bladder to find the cause of the blood in the urine. And, the thing is that flexible cystoscopy is generally done by a urologist. Dr. Mendenhall is Medical Director of Hazelden in Beaverton, Hazelden Betty Ford Foundation in Oregon.
It's nice to see you both today, and I'm really excited to be able to speak on behalf of men as part of the Drive for Men's Health. I'm Andrew Mendenhall. I'm an addiction medicine specialist, and it's important to recognize that alcohol is the most widely used and abused drug among men on a worldwide basis, and that's what makes this relevant to discuss. It's important to remember that most people who drink alcohol don't become alcoholic, but many men will suffer the negative consequences of drinking too much. The maximum healthy consumption of alcohol is between 1 and 2 drinks per week.
All right.
It's that time of the day. We need some pump me up music.
I used to bite my tongue and hold my breath. Scared to run a good boy and make a mess. So I said quietly, agreed politely. I guess that I forgot I had a choice. I let you push me past the breaking point. I stood for nothing, so I fell for everything. You held me down.
Up and running now. So Dr. Rose is at the Mayo Clinic in Rochester, and he's going to be talking to us today about Peyronie's disease.
Peyronie's disease.
And a very, very exciting topic. So Dr. Rose, I hand the web podium to you.
When you think of Peyronie's disease, it's actually a condition that not a lot of men know anything about. It's characterized usually by a couple factors, one being penile curvature, another penile pain, as well as what we call a palpable plaque, or an area of scar tissue in the penis itself. There are other things that it's associated with, including decreased penile length. It can also be erectile dysfunction, and really only about 10% of men notice any preceding trauma.